My name is Christy Lowenstein, and I am a Robert Wood Johnson Foundation Future of Nursing Scholar from Northwell Health, studying for my PhD at the Medical University of South Carolina. I'm studying parents' mental health and psychosocial well-being in the NICU because I want to find out what the experience is for parents in their own words and in quantitative terms in order to help clinicians understand the need for a neonatal intensive care unit screening and an intervention program for parents. 15 million infants are born prematurely each year worldwide. Postpartum depression in mothers of those infants is as high as 40%, and post-traumatic stress disorder in fathers is as high as 33%. That's nearly 6 million mothers and 5 million fathers that are at risk for impaired mental health and psychosocial functioning. These parents are a vulnerable subpopulation at an increased risk for depression, trauma, and anxiety for multiple reasons due to a convergence of risk factors. The available literature reveals a relationship between NICU hospitalization and parental distress, which accounts for several confounding variables like length of stay and birth weight, but there's no guideline that informs assessment or treatment of parents who have infants hospitalized in the NICU. Statistics related to other types of non-birth parents aren't even available. Impairments in parents' mental health and psychosocial functioning may lead to perinatal mood and anxiety disorders and other mental illness, which untreated in the postpartum period can contribute to decreased bonding and attachment with your child, negative effects to the parents' relationship, and negative effects on child development. Beyond all that, the real reason this interests me is my own daughter was born at 31 weeks, less than 2 pounds, and she spent 61 days in the NICU. And while we were there, I watched, and I thought to myself as a psychiatric nurse practitioner, why aren't we doing more for these parents? Why aren't we providing more services? So as I sat next to my daughter, I started planning what I wanted to study for my dissertation. So my study will include the following. What is the state of parents' mental health and psychosocial well-being in a level 3 or 4 NICU in an urban, suburban, quaternary care hospital or tertiary care children's hospital in the Northeast United States? Is there a difference in the incidence and prevalence of parent psychological distress between birth mothers and non-birth parents? And what is it like to have a child in the NICU? And how do you, the parent, feel about the experience? Thank you.